So by 6 weeks postpartum, about 40% of women were having sex, and about half of them were using contraception. By 12 weeks postpartum, about 92% of women were having sex, had resumed intercourse. But I think this study mainly focused on contraception. So what were the women using for contraception if, my goodness, they were having sex postpartum? But what's really interesting about this study is that they found also that most women, 75% of women, had trouble with their sexuality, felt that their sexuality was not as healthy or robust as it had been prior to pregnancy. And I think that's an area that we've really neglected to look at. At our table today, we talked a little about the crushed glass feeling and the sandpaper feeling of sex when you're breastfeeding or when you're postpartum. And I think that's a real area of concern that has not been addressed. Another thing to address is birth spacing. We need to be asking. Birth spacing is really a very important, is an important topic. Birth spacing affects all aspects of the mother, the child, and the future child. It affects breastfeeding, it affects mother's health, it affects infant nutrition, infant survival. Short birth intervals can lead to low birth weight in a subsequent pregnancy, can lead to preterm birth in a subsequent pregnancy, and I think many women don't know about that, as evidenced by our birth spacing data, which basically shows that about half of women have a birth interval that is less than 2 years. And what a healthy birth interval defined by the WHO and the CDC is basically to go from from giving birth to 18 months to your next conception. So it's not from birth to birth, but rather from giving birth to having another pregnancy. The recommendation from the CDC is 18 to 24 months. The WHO says 2 to 3 years. So essentially, this is something that women aren't necessarily hearing about or understanding, and it can lead to some poor birth outcomes. So how can we help women achieve their goals for childbearing and achieve their goals for their sexuality? So, of course, as a family planner, I come to my favorite thing, which is contraception. And in the family planning world, what do we think of as the optimal contraception is basically long-acting reversible contraceptive methods. We love our long-acting reversible contraceptive methods. IUDs, implants, we think that they're the answer for many, many things. But therefore, there's been a lot of interest in looking at how we can help women get access to LARC methods, long-acting reversible contraceptive methods. So one area of intense research in the last decade or so has been to look at how we can expand the time frames that women can receive LARC methods. So there have been many studies looking at putting in IUDs immediately postpartum, putting in implants postpartum before women leave the hospital, looking at giving women IUDs at 2 weeks postpartum and implants at 2 weeks postpartum, and basically trying to see if there's a way that we can help women use implants and IUDs more effectively in the postpartum period. But I have to ask, but what methods are most suited to postpartum women? Do women want these methods, and are they helpful to them? And at what time do women really want those methods? So there are a number of suggested topics for research in these 3 huge areas that I've been given 9 minutes to talk about. So in the terms of sexuality, we need to ask what changes occur in sexuality postpartum. I think women have many ideas about that, and some women feel that their baby is touching them all the time and they're not wanting to have sex, and other women want to resume their normal sex life with their partner and find that they can't do that. So how can women navigate the changes in their sexuality postpartum is an important topic that we need to explore. We also need to look at what role birth spacing and contraception play in women's postpartum sexuality. What do women want? We shouldn't be asking women, what would you like to use for contraception? We should be saying, when are you thinking about having another child? Do you want to have future children? And we need to help women understand the interplay between this idea, their needs for contraception, for healthy sexuality, and for spacing their children. And we also need to ask what other factors are playing a role. Clearly, sleep is a big factor in women's mood disorders, in sexuality, in all aspects of the fourth trimester. And there are probably others as well. Changes in relationship when you have a baby and things. So in terms of suggested topics for birth spacing, what are the barriers to adequate birth spacing? And what are families' preferences and motivations for birth spacing? And what factors influence birth spacing? These are important areas that we need to explore, and we need to understand what women want in these areas. And then finally, in terms of contraception, there's a whole host of questions that we need to be asking. We do know, for example, that overall contraception appears to be safe for breastfeeding, but there may be exceptions to this. So it may depend on what time a birth control method is initiated. It may depend on what type of birth control method is initiated. It may also depend on how much a woman wants to breastfeed versus how much she wants to prevent a future pregnancy. We also know very little about breastfeeding and contraception in women with premature infants and women who are just pumping as opposed to pumping in addition to breastfeeding. So I think those are really important areas that have not been explored adequately. We also need to understand what women really want in the postpartum period in terms of contraception. They need to, from our discussion today, want to understand, what's going on with my body postpartum, clearly, and how does that affect my sexuality, and then how does contraception fit into that? At what time point do I want it? What kind do I want? And what other issues might be involved with contraception? So, and I finished ahead.